Regarding CV, so after getting the app, the next thing I'm going to talk about is understanding your job roles. Now, let's say for instance, you would usually see here in Ireland, you would usually see posts like med-surg, theatre, ophthalmic, orthopedic, but most of these things come under bigger umbrella, which is general nurse. Because here they do not have registered theatre nurse. You understand? They do not. They have registered pediatric nurse, which is the children nurse, but they don't have like registered ICU nurse. I've already done a video explaining all of that. Now, for you to know how to target yourself, you need to ask yourself, what are you going there to do? I'm speaking with the hope that everyone here is not a midwife, a registered midwife. I mean, you're not coming here to work as a midwife. You are coming here to work as a general nurse. So that's the first thing you should have at the back of your mind. Then the next thing you're going to look out for is your area of practice. Where are you practicing? Some of us we are in female medical ward. I know if you are working in like a teaching hospital or a general hospital, you are in female medical ward, male medical ward, a male children ward, theater, accident and emergency. Then the accident and emergency is two. Um, like my teaching hospital had the children emergencies and adult emergencies, and then you have the male orthopedic ward, female orthopedic ward. So all those medical ward and surgical ward comes under a bigger umbrella known as the med-surg. So you will see like some job are advertising for a medical surgical nurse. So if you are working in orthopedic and areas like that, you are under the medical surgical department. Then some you go further to divide it, depending on what they deal with in their hospital. They'll go further to divide it into two and do medical nurses needed or surgical nurse. So, if you see surgical nurse, that means they are expecting you to work in a unit that deals with people going for surgery. That's the first thing you look out for. Then after looking at those ones going for surgery, look at the job description. You would see if they are looking for n- not just any other surgeries. It could be they are looking for orthopedics. It could be they are looking for cardiology. It could be they are looking for brain. It could be they are looking for any part of the body that has to do with surgery, post-op. Because here in their surgical ward, just as it is in the hospital back home, when patients go to theater and it is a severe case that needs a hospital admission, most of them comes from their house and then go to the where they call pre-op assessment clinic, which is where we will call it back home, like you're preparing a patient for pre-operative this thing, but it's just that all those things are mixed together back home in the ward. But here they have a pre-op assessment clinic. Like in my hospital, there's a pre-op assessment clinic where patients go there first to be assessed, and then they send them to the theater. From the theater, if they need admission, they are now moving from the theater to the surgical ward. So if a hospital is advertising for a surgical nurse, they're expecting you to see more things that has to do with post-op care in your CV. I hope that clarifies that. The same is with the medical nurse. they don't expect to see any surgery there. They're expecting you to see patient or bariatric patient, aged patient, patients with other medical diseases that does not require surgery. You understand? That does not require surgery. So that's it. If they are advertising for day procedure, day procedure now could mostly favor those nurses that work in the private sector, where they have lots of patients that just come in and go out, come in and go out. So the day procedure unit, what they do mostly is that patients come into the unit, they have some small small surgeries to do. We back home will call it these patients are going to like minor theater. They have like lipoma, cataract, maybe like breast lump, small small things like that, small small things like that. That back home, when you would say, this kind of case is not necessarily, shouldn't necessarily be going into theater. So yeah, they take their time to divide all those things. So if you are working like with a private hospital, but you deal with those kind of cases in and out kind of patients, then or patients that are just coming for endoscopy, any of the internal organ assessment, then you could be targeting the day procedure and clinics kind of jobs. I hope that clarifies it. My next video, I'll continue from there. So the first thing first is to understand your role and the kind of job you should be targeting. So in continuation, now that you've understood your roles and what kind of job you're setting out to apply for, let's go into the CV proper. Now, if you follow the app that I suggested, it's not like there are not other apps, but that is just the two that I feel is very perfect. Now, let me say this here. When you're using that app, be very mindful not to just do copy and paste. Remember that thousands of people are using this app. That's one. Remember that job roles differs. The app is going to suggest things, words to you. There is no bad in taking what the app is saying. But when you're copy with a brighter mindset by not just copying everything, but try to vary your own sentences. Now, the app is going to start by asking you to create an account. So you create an account. After account creation, you need your email, your date of birth, and your full name to create an account. If you have if you have a middle name, just either you add it to the first name space, or you check if there is space for middle name, you add that to it. That being done, you create an account and then you go on and click on create my CV. Now, it now starts asking you your education, your job roles. So your education, you're going to start from your highest education when you're imputing. So if you have a master's, you put the master's first. If you are whichever one is your highest education, start from there. I think the app will even tell you that to start from there. That's for education. So for education as well, there's no need to you go and put secondary school and primary school. No, just your degree and your professional qualifications. That's fine. I'm assuming I'm speaking to nurses. So if you went to the degree, you put your degree and then you put your registered nurse, your registered postgraduate, anything you've done, or post basic registrations you've done, just put that on and that's fine. Then you go ahead to put your professional summary. Now, in your professional summary, that is like you giving a brief explanation to yourself. So you're going to state how many years of experience you have, what kind of a nurse you are, what kind of setting you've been working. Is it acute setting? Is it the non-acute sector? Like if you are not in a hospital, that is not an acute setting. That said, that's what you're going to. So there's no need you're going to put a enthusiastic, this one, a passionate, all those ones. Everybody knows that. So use some. The app actually suggests very good statement. So you're going to vary yours by putting other things, and then including if you've been working the acute setting, if you how many years you've been working, the kind of experience you have, and what you can bring to the table. That's just a brief explanation of professional summary. 3, 4 sentences, that's fine. The next thing you're going to see there is the skills. Now, when you are talking about skills is like you giving the absolute job that you do. For example, I'm going to use myself. I am an ophthalmic nurse because I can't give everything about what your job is. I am an ophthalmic nurse. I work in the eye setting. So I was looking to apply for ophthalmic nurse job. I know that as an ophthalmic nurse, what I do for my patients, visual acuity, I do. As at that time that I was in Nigeria, that I didn't have other skills that I have now. So visual acuity, I do tonometry. I can give subconch injections. I can help in scrubbing for like setting for surgeries, the kind of surgeries I said for cataract. I can, those are the things that were in my skills. Then you go on to add things like you save administration. I do eye installations. I do pain management. You know, health education is good, but health education is like a basic. It's like a basic skill a nurse should have. It's not the kind of skill somebody is looking for when they're looking to employ you overseas. That's not what they're looking for, because anybody can health educate. Okay, so those ones are not shouldn't be part of your skills. Those things that makes you different from the next nurse. If somebody is working in eye and you are working in theater, those things that makes you different, that is your skill. That's your skill. I hope that explains it. Next video, I'm going to continue the remaining part of the CV. I don't want it to be too bad. Thanks for watching.